Hello, my name is Vinicius Silva. I'm a student of the Technological University of Paraná, and today we are going to talk about rheumatoid arthritis.
What is rheumatoid arthritis? Rheumatoid arthritis is a disease that causes inflammation in the joints. This inflammation leads to pain, swelling, and stiffness in the joints. It happens when our immune system, responsible for defending against invading microorganisms, becomes confused and attacks the body's own tissues, including the joints. Who gets rheumatoid arthritis? Rheumatoid arthritis affects 1 in every 100 people and is 3 times more common in women. It can start at any age, but it is most frequent between the ages of 30 and 50. What are the risk factors for the disease? Smoking, gingivitis, and certain types of genes. Although we cannot change our genes, we know it is important to stop smoking and maintain a good oral hygiene. What are the symptoms of rheumatoid arthritis? The main symptoms vary from person to person. However, in most cases, rheumatoid arthritis begins gradually, with pain and swelling in the small joints of the hands and feet. At the start, it is common for the person to feel very tired. A remarkable characteristic of rheumatoid arthritis is the sensation of joint stiffness, as if they're rigid and hard. This stiffness usually occurs in the morning, lasts for more than 30 minutes, and improves throughout the day. The most common report among patients is that they can only carry out their daily activities after their joints warm up. Rheumatoid arthritis can also cause inflammation in other parts of the body, such as the eyes, blood vessels, and lungs, although these symptoms are much rarer.
How is rheumatoid arthritis diagnosed? The diagnosis is made by a doctor through an analysis of signs, symptoms, laboratory tests, and imaging exams. The symptoms have already been discussed. The most important tests include complete blood count, CBC. Many patients present anemia, erythrocyte sedimentation rate, ESR, and C-reactive protein, CRP. These blood tests help the doctor determine the level of inflammation in the patient's body. Rheumatoid factor, RF, a blood test used to detect the presence of antibodies in the body. Anti-CCP test, used to measure the amount of CCP autoantibodies produced by the immune system, which attack the joints. It is important to note that these tests alone aren't sufficient for a diagnosis because RF and anti-CCP can also be found in healthy individuals. X-rays are another important diagnostic tool, as they reveal the damage rheumatoid arthritis causes to bones, known as erosions. Bone erosion is a process that occurs when bone tissue is lost, resulting in weakening and deterioration of the bones. What is the treatment? The ideal treatment for rheumatoid arthritis must always be prescribed by a rheumatologist. There are medications that can only control symptoms, such as anti-inflammatories, corticosteroids. Additionally, there are drugs capable of reducing the deformities caused by the disease. These are known as DMARDs, disease-modifying antirheumatic drugs, which can be either synthetic or biological. Together with medication, physical therapy is also essential to control symptoms and maintain joint function. What can be done to the patient feel better? It's important to stay active. Many patients avoid exercise due to the pain, but inactivity worsens the condition. Inactivity can weaken muscles and increase the likelihood of joint stiffness. Maintain a healthy diet. Patients with rheumatoid arthritis are at an increased risk of developing heart disease. Is there a cure? Although there is no cure for rheumatoid arthritis, treatment is available to control and reduce the damage caused by the disease. The earlier treatment begins, the lower the chances of developing deformities caused by the disease, significantly improving the patient's quality of life.
I hope you understand the importance of knowing more about this disease. Thank you for watching.